So I now have the pleasure to introduce Dr. Dinh. He's a gynecologist-oncologist and assistant professor at Mayo Clinic in Jacksonville, Florida. One interest of his is medical education, as he is the director of the Mayo Clinic Minimally Invasive Gynecologic Surgery Fellowship, which I took part in, and president and founder of Project TVD, a nonprofit foundation dedicated to improving healthcare in developing countries. Please welcome Dr. Dinh for his presentation.
Thank you so much, Chris, and it is certainly an honor to start off the Mayo CME course with my lecture. And so I ask you, how do we learn how to do what we do in the operating room? And who do we learn it from? There's certainly no book that we can read and get the nuances and tips from surgery. And so we learn from our mentors, whether it be in residency or in fellowship training, and we learn from their stories, their anecdotes. So today I'd like to tell you about some of my stories from my training and from my early part of my career, how that informs me in the operating room, and hopefully give you some tips to help you in your OR as well. So early on in my career, I was working at a hospital in Houston, and one day I came into the operating room suite. I saw a very good second-year resident, and she was completely shell-shocked. And she told me she just put a trocar through the iliac vein. And I knew that day she was operating with a very experienced senior surgeon. I wondered how two very good surgeons can let this happen. And what I realized was there was a height differential between the two physicians. So who do we put the table most comfortable for? We put it at the height of the most senior physician. So the junior physician, being a lot shorter, was at a mechanical disadvantage. So she pushed and pushed. When you get through, you go right into the iliac vein. The second thing for many of us who operate with very young surgeons is that for the young surgeons, the one in training, they take this minimally invasive surgery a bit too seriously, and they make the incision a bit too small. So you get that skin dystocia. You push, once you push through the skin, you get through everything else really easily, and you go into something that is unintended. So my tip to you, especially if you are operating with less experienced colleagues, is make sure everybody in the